Welcome again to TVAsia Telugu channel Healthline. I'm your host Varsha Singh, and my effort is to bring you the best health information which is available right now that can help you in improving your quality of life. Not only that, you can share this information with your family and friends. This is a special series which talks about integrative, alternative, complementary, and natural medicine. So, in last episode, I started bringing practitioners who are practicing an alternative medicine, which is also known as homeopathy. Today, in this episode of Healthline, I have great pleasure of introducing another homeopathic practitioner from India. And this practitioner has specialized in a special kind of treatment modality. So let me welcome Dr. Vijaya Patil. Dr. Vijaya Patil practices in Mumbai. She is MD homeopath from Mumbai, graduated from Mumbai University. She's practicing homeopathy for almost 30 years. She has gained her experience dealing with special children. Welcome, Dr. Vijaya Patil, to Healthline on TV Asia Telugu channel.
Hello, Dr. Varsha. I am very thankful to you for introducing me. Also, I am thankful to TV Asia Telugu channel for giving me this platform to connect to the community. I'll directly go to your answer your questions. That see, since 30 years I am practicing classical homeopathy at various places in Mumbai, and I have had the opportunity to treat various clinical conditions ranging from allergy to infective to degenerative diseases, autoimmune diseases, cancer, etc. But Dr. Varsha, my practice became very exciting and challenging when I started seeing patients of like complicated pathology like HIV/AIDS, and more exciting when I went into the field of special children, where I was able to see, children like autism, ADHD, learning disability, and I was very much excited to explore more and more, like what we can do in this type of disorder. That way. And then the journey continued, and I established my center of Sparsh Homeopathy, where it is a homeopathic center. We see all kind of patients here with all kind of diseases. But as you said, it has a special unit for children with developmental and mental health problems. So this
Great.
way, my journey is becoming more and more exciting.
Thank you. Thank you for sharing about what you do now. My question is, what's the day-to-day patient population that you treat today, and how from a classical homeopathic practice, what led you that you became so can you share your experience in past 30 years? How did you step by step, like if you talk about your chronology, that I started my practice as a homeopath and then you had an experience,
Yeah,
we would like to learn about a little bit about your journey as a homeopath in past 30 years.
yeah. Yeah, see, Dr. Varsha, I think it was my destiny that I was doing very good in my practice. I was very happy with all the results which I was getting with homeopathy and all. But then in 2000, I joined MB Barwalia Foundation's Spandan Holistic Institute, and there I had the opportunity to see all these cases. We used to observe, we used to learn lot of things under the guidance of Dr. Praful Barwalia, and then I got the opportunity also to treat these patients there. Okay, so we used to see lot of patients there, and frankly speaking, before joining Spandan, I had very less exposure to all these cases. So as I was treating all these cases, and later on the project came of autism, that is homeopathy and childhood autism disorder, and I was a senior research assistant in this project. So I had a very closeness with dealing with all these kind of cases, and mostly autism. See, we were dealing with all kind of cases like learning disability, intellectual disability, ADHD, behavioral disorders, mood disorders, anxiety disorder, but I was more involved with the research project of autism.
Mm-hmm.
And the result of the autism project were so, astonishing. Like, I came to know that homeopathy can do so much in these kind of children. And the results were, see, I will not go into the technical terminology of the research data and all, but if anybody who is listening from the research field, I would like to tell that the p value was 0.001. That indicates that the results were very positive. Okay. And in, if I have to talk in a very layman term, that 60 to 70% cases we were able to produce lot of changes in the child, so
Great.
that was very motivating for me. and and I
Great.
decided to continue it, further. So when I left Spandan, then I thought, whatever knowledge I have gained, I have to utilize it. It should not go waste. So at Navi Mumbai, I started with my own center, Sparsh Homeopathy and Childcare Center. See, so here, because in Navi Mumbai at that time, there was no such center where homeopathy was given along with all the therapies. So
Mm-hmm.
I'll just, in short, I'll tell you about this Sparsh Center. This Sparsh Center, as I'm again and again telling, it is a homeopathic center, but it has a special unit for developmental and mental health problems. So these children, they require all the therapies, along with the treatment, like therapies like occupational therapy, speech therapy, special education, behavioral modification. We need clinical psychologists, counselors. So all these facilities are available under one roof. So the Sparsh Homeopathy and Childcare was established with the aim that everything should be at one place, and parents are comfortable coming to the center, going through all the therapies, going through all the treatment. So it was an advantage for the parent that they don't have to go places to places to places for each therapy. And other advantage of Sparsh Homeopathy was that we all were available under one roof, so we could communicate to each other. So we are communicating to each other about the same child. Every 3 monthly we do meetings and we discuss about the child. What is the benefit of this? What we can do further to improve the prognosis of the child. So this is the benefit when everything is available under one roof. So the treatment protocol for the child can be, made better and better with the discussions.
Sorry. So, going back to the question. So, I know that you talked about how you created your center, but what I really want you to tell our viewers a little bit about autism before we go and talk about what is your approach, your own approach, your unique individual approach for cases for all these children under that diagnosis umbrella. I really want our viewers to understand why we are focusing on autism. Because if we look at the autism spectrum, and if we look at the treatment perspective, and if we look at how the management is in standard management, if you go look at the modern medicine managing this learning disorders, learning disability, autism, attention deficit. So homeopathy comes in play, providing something that is a little bit extra. And that is what I want you to elaborate. What exactly is this autism and why homeopathy has some scope of providing management where you actually found changes during your research project and significant value of 0.01. It's highly significant. So if you can talk a little bit about autism and then we will go about your own approach.
Okay, Dr. Vasha, I'll just let you know in nutshell what is autism. Like, see, for a common people, I'll say autism is a neurodevelopmental disorder which you diagnose during the developmental period of the child. And mostly you will diagnose it before 3 years of age. You will be able to diagnose it, though you will be able to diagnose it very early in your in the infancy period also, but maximum by 3 years you will be able to finally diagnose it that your child or any other child is having autism. As autism is a neurological disorder, it affects your brain, so it affects the development of the child. The development is either slow, or it is not there, or it is abnormal. you know so I'll just tell you what are the symptomatology of autism, which you can pinpoint. Like a 1 year child, I'll talk in a very simple language. Like a 1 year child, you smile at that child, and that child will smile at you. If you call him or her by name, he will look at you. You know, if you tell him small instructions, he will follow it by 1 year also. But then you see that your 1 year child is not looking at you. The main is eye contact. When you look at the child, he will give you the eye contact. So if you feel that by 1 year also your child is not giving you eye contact, he is not smiling, he is not responding back, then that should create an alarm in your mind. As you go further, the children, they like to mix with other children, they like to play with other children, they will speak, they will share their emotions. But these children will be aloof. They will sit at one place, and they will be with their own only. They will not notice that somebody is there in the room. They would not like to play with them. Also, the speech development is very much delayed. So by 2 years, if you see your child is speaking, they are making sentences, they are sharing their emotions, they are indicating their demands and all. But this child will not be able to speak. And we have seen, we have got children of around 3 years also, which are brought to us only with babbling. The speech is still not developed. So the main problem with autism children is delay in the social skill and the communication pattern. When the speech is not there, how the communication they will be able to develop. And the second important thing in autism is the behavior part. There is a repetitive stereotype motor behavior, or interest or obsession. you know so they will continuously keep on doing something, like I'll say they will flapping of hands, or they will just keep on jumping, or there is obsession for material, like they will collect the cars, they will collect the bottles, they will keep the pen in the line. These are all the obsessive behavior of these children. Sometimes they will just sit and they will look at the fan, look at the wheel of the car. So these are all obsession of these children, and they are repetitive. It is not that it has come and gone. They will repeatedly do it. The third thing in autism children, you will notice the sensory issues. Their senses are either hyperactive or hypoactive. Like in many children, most of the children we have seen, they are very sensitive to noise. Noise will create. They are very lot of fear of noise, and they will close their ear. Or if they are frustrated with the noise, they will throw all temper tantrums listening to noise. In our India, fire, crackers, and all that will be a very difficult period for the parents to handle the child. The
Wonderful.
other, yeah, the other thing is the rigidity of behavior. They don't like change. They want the routine to be exactly like that. What is happening. They want the same road. They want the same pattern of eating pattern, the going out pattern. Everything should be same. The change is not acceptable to them. So these are the main symptomatology for autism.
So, Dr. Patil, I want to ask you, when you are treating your patients, I'm going to
Yeah,
jump to another question right away, that how do you approach these cases? But this is a
yeah.
burning question. Do you have children coming to you and you diagnose them with these disorders, or you're also collaboratively working with neurologists and pediatricians who refer those patients to you?
Yeah. We have all kinds of experiences. Like children have come to us in a raw condition where they had not gone to any other doctors, and they have first come to us and we have diagnosed. As I told you, we have all the team here. So once we know that the symptomatology is there, so we refer them to clinical psychologist. We confirm the diagnosis. There are so many psychological assessment which can confirm the diagnosis. For autism, it is CAS, that is Childhood Autism Rating Scale. So once the confirmation is there, then we can plan for the treatment. But we get many children who are already diagnosed from the developmental pediatricians, from the developmental neurologist, and we have connection with all these doctors, and continuously these people are referring children to us, because see, in these children, no, from treatment point of view, you know, they also give only vitamins. There are no medications, modern medications which are available for the treatment of these disorders, you know. So they also understand, the neurologist also understand, the developmental pediatrician also understand, if we have to give them something extra, then we have to refer them to homeopathy. So I have been, since I am practicing since so many years, I have my developmental pediatrician, I have my neurologist with whom we collaborate continuously, and they are also sending us patient, and we are also sending them patient to have a proper diagnosis in complicated cases and all.
Thank you so much. It sounds like you have a very comprehensive approach with multidisciplinary opinions, and there is a comprehensive diagnosis so that you are accurate with the diagnosis before you even start your homeopathic approach. And that brings me to this question: how do you start management of this patient? What is your unique approach?
Yeah. See, whenever the child is coming to us, see, we get all, as you know, in homeopathy, we have to take the detailed history, you know, and not from homeopathic point of view, from the clinical point of view also, and also from the causative point of view. See, autism is a, in terms of causes, it is a multifactorial phenomenon. Nobody can pinpoint that because of this, the autism has happened. So we have to go in great detail, you know, right from the marriage, time of marriage, like the consanguineous marriages, marriages in relation, that are the very much positive factor for autism, you know. Then we, if we go beyond that, the pregnancy period, we inquire everything in detail about the mental health of the mother, the physical health of the mother, any medicines if they have taken, other diseases like diabetes, obesities, because they all can contribute to autism. You know why I'm describing all this, because people should know that what care they should take during the pregnancy period, even before pregnancy, what care they should take before they are marrying anyone, you know. So as you move further, we will inquire all the details about birth details, you know, whether it was a premature labor, or there was any fetal distress, or the child cried immediately after birth, because the fetal distress, the delayed cry can produce hypoxic brain damage, and that also can lead to autism. You know, once the child is born, then for the 2 years, the period is very critical for the child. We all inquire everything about whether he has suffered from any infective illness, how much vaccination he has received, or any mentally, whether the child was disturbed and all. And I will just give you my experience. Like one child, you know, he was around 2 years, and then the parents were very strict, you know, and they were not knowing about the child's condition. But then they were so angry with the child, they locked the child into the bathroom, you know. So the child was so frightened and so shocked. So when he came out of, he was locked for 3 hours, you know. Okay, and when the child came out of that bathroom, they noticed that his behavior was very odd, and whatever speech was there, that has also gone. So we have seen such cases where such incidences can be a triggering factor for the start of the autism. One interesting experience I'll tell you. See, during the labor pain, see, you have a premature labor pain. So what we do, doctors do, they give some injections and they stop the labor pains, you know, and then they wait for the natural labor pains after completing the 9 months. So this happened in one girl she was having ADHD. So when her premature labors were stopped with the injections, when she was born, the first thing what happened to her was convulsions. People who are homeopaths who are listening to this interview, it is a very interesting point for homeopaths, you know. He, the child was frightened when the premature labor were
Within the
suppressed,
home.
and fright,
Mm-hmm.
and that fright had led to the convulsion once the child was born. And when we connect like this, there are beautiful remedies in homeopathy. And her total full ADHD, she was brought to us at the age of 4 years. But when you take all this history, it gives you the link, from where it has started. And from homeopathic point of view also, these all symptoms are very important. Even if we are treating ADHD or autism or anything, we have to inquire everything, right from the clinical point of view, from positive point of view, from homeopathy point of view.
Just to clarify, Dr. Patil, it is the homeopathic potentized medication and it has a therapeutic value. So, Dr. Patil, can you talk about when a patient comes to you with a certain diagnosis of, say, any learning disability? So, when you do case taking, as you said, you do a very detailed case taking and then you treat your patients using homeopathic medicine. What else is included in your management?
Yeah.
Because you did mention the multidisciplinary approach.
So once the case is taken, as I told you, we confirm the diagnosis and then we prepare the treatment protocol for the child. So homeopathy is the therapeutic measure used in all these childrens. But along with that, their requirement for therapies, like ADHD child will need occupational therapy. You know, autistic child will need occupational therapy, speech therapy, behavioral modification, sensory integration therapy, which is a part of occupational therapy. See, in occupational therapy, in short, I'll let you know that the fine motor skill, the gross motor skill, the sensory issues, the behavior, the concentration, they all work on all these factors. In speech therapy, they will work on the qualitative and the quantitative aspect of the speech. As I must not have told you that these children has lot of speech problem, like echolalia. Echolalia is where they repeat the same thing again and again. And the other thing is they have lot of non-sensible speech, which they babble, they speak, but we will not be able to understand. So these are the qualitative aspect of the speech, which the speech therapist will work on, as well as the quantitative aspect. At 2 years of age, what is the level of speech the child has gained, and they will work further on that way. So the speech therapy, the occupational therapy, and now you asked me about the learning disability. The learning disability children, they come very late to us, because when they go to the school and then the teacher finds out that this child is not able to write, not able to read, not able to do maths, and then it is the parents come to know through the teachers that yeah, my child is having some academic difficulties, and these children are then diagnosed. They are put on homeopathy, but they are also given special education. A special educator will teach them according to their method, and they will try to correct their perceptual difficulties. These are perceptual difficulties in learning disorder, so they will try to correct it. So all these children, these are all different for different children. No child in a field of special child, no child is same. Every child is different, and every child has to have a different therapeutic plan according to their therapeutic problems.
Yeah.
So
So,
multidisciplinary approach is the must in all these children.
as I have learned, it's always an individual approach. Everyone is a unique case.
Yeah.
Everyone is not treated with the same medication, and you spend enough
Yeah.
time evaluating their history, not only from the birth, but even pre-birth, like how their mothers have experienced the pregnancy and the diet, considering all these factors when you plan management of these patients.
Yes.
My question here is, when you start treating your patients, those children, what changes you expect to see in them? Because when someone is brought to you, they are definitely expecting a management, so that it gets a little better. We all know that there may not be a complete cure, because autism is definitely linked with genetics, autoimmunity. So, what are the expectations of the parents when they bring these patients to you, and what changes you expect to see in them?
See, again here, the same changes will not be produced in all children. You know, it is individual. Now, first as you know, it is a autism spectrum disorder. That is, there is a spectrum. So first we have to diagnose and put the child where he lies in that spectrum, like mild autism,
Mm-hmm.
moderate autism, and
Mm-hmm.
severe autism. Okay,
Mm-hmm.
and in 70% of the cases, autism is associated with this intellectual disability. Developmental delay, social delay, and intellectual delay. So we have to grade the child. The mild autism with mild intellectual disability, or moderate autism with moderate intellectual disability. The third point is associated neurological disorders
Mm-hmm.
like epilepsy.
Mm-hmm.
With each episode of the conversion, the child will regress. So we have to define where the child is lying in that spectrum. So I'll tell you, a mild autism with mild intellectual delay will have a better prognosis, while the moderate autism with moderate intellectual disability will have some limitation in terms of future outcome. So that way we cannot see parents come and ask us, what will whether he will become all right, and in how many months you will be able to produce results and all. But then we have to tell them, see, it is not like that. First we will do all the test, everything we will take in detail, and then we will be able to tell you in how much period and at what level we can produce the changes. Like in autism, when we are treating, we have seen that the changes are occurring first at the level of behavior. The hyperactivity is reducing, the temper tantrums are reducing.
Mm-hmm.
Second, we have seen the changes at the level of intellect, understanding, comprehension. So when the comprehension is becoming good, so you start responding to people, you start following the commands, and as your comprehension is improving, later on, then the speech problem is also becoming better and better. And later on, the sensory issues. The first thing which you will feel changes are in behavior and the understanding part of the child, the comprehension part of the child. So we can produce results at all the levels in autism, but again it will depend upon what is the degree of autism, what is the degree of intellectual disability, and what are the neurological problems associated with it. And also, if the child is brought at a very early age to you, see, this is the fact. If you start the treatment early, and uh, if you do the treatment with consistency, the results are going to there.
And
So our
this is based on your experience and
yes,
the number of children you have treated and 30 years that you have invested in this practice. It sounds promising. And then I just want to ask you to share some of your success stories, because this is exactly what viewers would like to know, that yes, we know your approach, and you know that what changes you want to see when you start treating a patient. And I'm sure in your practice you have seen it happening. So if you can elaborate on some of your case studies.
yes, Dr. Asha, we have many success stories. So I will share a few with you, like where we have produced wonderful results, and we were happy, parents were happy and all. See, this was a girl she was brought to me when she was 2 years and 10 months, by the parents. So at that time, she was speaking only three words, mama, papa, and kaka. Huh? These words were also mechanical, not in context with mummy and papa. So she was speaking only three words. Her eye contact was very fleeting. She will not respond when you call her by name. She will not follow simple, commands. quarter to 3 years child follow everything, but she was not following. She was having obsession of, collecting bottles, and she was very obstinate, lot of temper tantrums and all. So these were the complaints of the child, and this child had not gone to any other doctor. First time they brought her to our center, and then we did all the clinical assessment, cars and all, as I told you, childhood autism rating scale. And she was following, her cars were, score was 33. That means she was following into mild form of autism, but her SQ was very good, social quotient, that was 70/84, which is a very good SQ. And when it is a mild autism and a good SQ, we expect that the outcome will be very good. So with that hope, we started the treatment, and within 1 year, she started speaking. uh, she started sharing, what she wants, what she doesn't want. She started learning numericals, she started learning alphabets. See, here in this platform I cannot share the videos, or because we have confidentiality, but just believe me that within 2 years, she was sitting in front of me answering my questions. Whenever I'll ask any question, she will answer it. And then we again repeated her cars, after 2 years, and the car had come to 28. The score had come to 28. Whenever your score is below 29, no, you fall into a non-autistic category. If your scores are above 29.5, then you are autistic. Like that. So her scores had fallen into a non-autistic zone, and she was doing very well. They continued to see, this patient had come to me in 2013. They continued treatment till 2016, and then they shifted to USA. From there also they were communicating to me, though the medicine had not been given after 3 years, but they were in communication with me. Last year they sent me a video. Now she is in 5th standard at USA, in some school, and last year they sent me videos of her where she had taken part in the school dance, and the synchronization which you can see in her dance. Nobody will say that she was an autistic child. She is learning dance, she is doing everything. So seeing that, no, you feel so much, happy that what you can do in these children, like how homeopathy works. And in this case, no, what was the extra thing, that therapies were not given so consistently, because mother was at native place, and there the facilities of therapy were not there. So this child was mostly on homeopathy, and plus mother used to do whatever she could do with the child. But with that also, the results were very amazing. So
Sounds very
this gives a lot
promising.
of this gives lot of motivation. Other child I will just share with you. This was a child of 3 years 10 months. Okay, he was brought to us, and he was already diagnosed that he is having autism and all. But then we again did his CARS, childhood autism rating scale, and the scores for him were 33 30, sorry, 30. The scores were 30, and he was also falling into mild autism. His SQ was also very good. So again we expected a very good result in this case. So again, all the symptoms, I will not repeat again. The eye contact was not there. There were a lot of, behavioral problems. Speech. This child was not having speech at all. He was just babbling. So this was the case, and then we started the treatment. Again, in 1 year, his speech, he gained his speech. He was only babbling when he came to us at 3 years 10 months. And when he was around 4 years and 2 months, slowly he was gaining the speech. But at 4 years and 2 months, he could sit in front of me, he could answer what I was asking. His all stereotype motor behavior had gone. One very special thing in this child, you must have heard of autistic savant. They have extra
Yes.
hidden potentials, you know extra hidden potential, extra miraculous skills they have. So this child was having this, this child, when he came to us, he was not knowing ABCD, he was not knowing any numericals 1, 2, 3. But now at 5 years of age, he he could do subtraction and addition of 4 digits orally, without writing on the paper. See, if you will also give me like 2433 minus 19, I will take some time, to subtract and to give you the answer. But he will do it in fraction of second. So a child who was not knowing anything at 3 years, 2 months, at 5 years of age, he is knowing the subtraction and the addition orally of 4 to 5 digit number also. So sometimes we say that when we give homeopathy, the hidden potentials, they come, surfaces.
Accentuated.
Yeah. So that case was also a very amazing results, and we were happy. Parents were happy, and all.
So,
These are the two cases. If you want, I can share more.
yeah, I have a question about did you ever treat not a child, but say it was an adult who had such learning disorder? Did you have an opportunity to treat someone in that age group, which was
Mhm.
very late, possibly? And if you had any success in treating?
See, we had few cases, but the problem was that the consistency of the treatment. You know, as you know, Varsha, I have told you that as early you start the treatment, you will be able to help the child more. As the age passes, everything is so inbuilt in the child that it is very difficult to change. But I see today I have a child of 30 years also with me who is under my treatment. And what I have done in that child, where I have produced results in that child is the behavioral problem, the behavioral disorder. This child had lot of temper tantrums. He used to hit himself as well as others. So I may not have been able to produce results at the level of communication, speech, but at the level of behavior we have produced results. And sometimes parents come and they say we are not worried about the academic problem, we are not worried that whether he will become something, but please control this behavior. Because that is irritating, that is troubling us. So, as I told you, in every child, you have a different therapeutic problem definition. What you have to treat in this child. So, in adult, we have seen that we have to treat more of the behavioral disorders. You know, in one adult, we have controlled behavioral disorder along with epilepsy. So, everywhere the therapeutic problem definition is different.
Thank you for sharing all your experiences and your success stories. And as I'm listening to you, and you mentioned m- while narrating your case studies, how parents also play an important role in management of these children who have learning disability, dyslexia, ADHD, or autism. Can you talk a little bit about what is the role of parents in such cases?
See, parents are the key factor for in treatment of these children, because they are the first person who will notice that there is something wrong in their child. And before that also, the role of parent, I will tell you, the role of parents start right from the time of marriage. They should have this knowledge that consanguineous marriages may lead to some disability. So from the marriage, from in the pregnancy, how much care they have to take of themselves, the mental state, the physical state. And once the child is born, you know they are the first person who will notice that something is wrong with their children. And if they are noticing that any illness, like it is ADHD or it is autism or anything, like, so they have to go to a proper doctor, like developmental pediatrician, developmental neurologist, or any of the good homeopaths and all. So they can go there, they can seek help from these specialists. Because as I am again and again I'm telling you, as early you diagnose it and as early you can start the treatment, the results are very fantastic. like that. So they play a very key role. I'll tell you ki therapist, therapists play a very important role in these children. But therapy you will do once, twice in a week, thrice in a week. But these therapies has to be repeated at home every day, and that only a parent will be able to do it. So they have to take care. I understand these children are very difficult to handle, and sometimes we have to counsel parents a lot that yeah, we understand your pain, but there is no escape. You have to be with these children, you have to take care of these children, and have to keep patience to deal with these children. So I think parents, the teachers, the therapists, they are the important people in the child's life.
Thank you for pointing that out. We understand that consistency and continue to provide that therapy sessions at home are equally important, and definitely parents play a crucial role. So finally, when you are continuing your practice and journey as a homeopath and focusing on this special group of patient, I would like to ask you, what would you tell our viewers, a message from someone who has been focusing on one special diagnosis? And if our viewers are looking for more answers, where do they go and how do they explore?
See, I will say that be observant, be educated, know about all these disorders, because our eyes see what our mind knows. If your mind knows about it, then only you will be able to see in the children, whether they are your own children, or you are a teacher, or you are a caretaker. So please have knowledge about all these disorders. Once you find out any problem is there, any discrepancy is there in the child, please take a proper help from specialist. Like we have pediatrician, we have developmental pediatrician, we have developmental neurologist, we have homeopaths. So go to them, take their suggestion, and start the treatment as early as possible. Once the treatment is started, be patient. Don't expect that results will be there in 1 or 2 months. No, it's a long term treatment. Please give homeopathy to all these children. Even if nobody is suggesting, you take your decision and take him to some homeopaths, and do it consistently. Because one last thing what I will like to tell you, see, our brain develops till 5 years of it. The brain development is maximum till 5 years of age, and later on it slows down. So till 5 years of age, if you introduce anything to the child, it will have a much better effect than you introduce it after 5 years. So my telling again and again that please spot it. If any problem is there, take it to the doctor, start the treatment as early as possible with consistency, and be patient, and the results will be there.
That is a very wonderful message from you, Dr. Patil. Just elaborating your message that yes, we need to be aware, and that's why Healthline brings this informative episodes and practitioners from all around the world to our viewers. And everyone has to learn what kind of treatment, if they are seeking a holistic or alternative or natural management path for these conditions. It's a team approach, and as you correctly said, that consult your primary provider, your pediatrician, as early as possible. And in many countries, as soon as the child is born, there is a schedule that they have to follow: 1 month visit, 2 month visit, 3 months, 6 months. Not only for it's a comprehensive growth of child, as we say, physical as well as mental growth. So you have given a very important message to our viewers that just make sure that once you bring this life in this world, you are taking care of this life in a systemic way, so that you provide this child a very healthy, physically as well as mental environment. You nurture this life and take care of it. Thank you so much for sharing your expertise, your case studies, and your advices on Healthline on TVAsia Telugu channel. Dr. Vijaya Patil, the owner and homeopathic practitioner of Sparsh Homeopathic Center in Mumbai. And I
Thank
appreciate
you, Varsha.
everything.
Thank you, Varsha, for your kind words. And I'm also very happy to share my experiences with you people. And also thankful to TV Asia Telugu for giving me this platform.
Great. Thank you, Dr. Patil.
Thank you.
So, my viewers, this was Dr. Vijaya Patil who talked about her practice, her homeopathic practice, and her experiences treating children with autism, attention deficit, hyperactivity disorder, dyslexia, learning disability. And she treats many other conditions, not just this, specialized conditions. And she has her center in India, Mumbai. uh, I had great pleasure talking to her about a different approach of management of these disorders. And this is an effort to bring you an information so that you are having a little bit more awareness about alternative therapies which are available across the world. And as a viewer and as a learning viewer, you can always go and learn more about at the website of Sparsh Homeopathy. And there are many other websites that you can learn more about this mode of practice. This is the alternative branch of medicine. Always make sure that you always consult your primary provider, that is your primary doctor, when you are considering to opt for any other treatment management, because we know that they are aware of your full history and your conditions. This is an effort to bring you something else out of your regular medicine practice. So continue to watch this special series of integrative, functional, natural, alternative, and complementary medicine on Healthline, TVAsia Telugu channel. I will be bringing you many more practitioners who are practicing something different, and it may bring some answers to you without any bias, without any contradicting a statement or conflict. It's my effort to put it out there for you so that we all learn together. Thank you for watching. I'll be back again. Don't forget to watch my next episode, Healthline, TVAsia Telugu channel. I'm saying bye for now, your host Varsha Singh, and come back again to watch another episode. Thank you.